Cool.
Yeah, we are on top of it. And then I think we're in the YouTube right now for us to deal with our topic today. Lawal, it looks like, okay, good. Well, you people have seen that when you deal with professors, the professors are professors. That's why Chikara worked so hard by jumping from VCN building into the university for him to be a professor. You know,
Teaching has always been my.
yes, Amina is on the line. You know, it's good to be a professor to separate us from Professor Mister. Sorry, Doctor Mister to Doctor Professor. It's not a day's journey.
Yes.
Yeah, Johnson. So Amine,
Prof.
I tried to bring Wakawa to see whether I can moderate you because I wanted Brains to moderate you. But
Okay.
Unfortunately, Wakawa could not come. So Amine,
Yes, sir.
We don't. Do you have his profile? Yes or no?
No, I don't.
You don't have. Okay. Professor Lawal, please describe yourself in 2, 3, 4 words so that we can move on. You can only describe yourself. We can't describe you unless what you give us. So that thing you are giving us, just describe yourself, just a bit, and then we'll move into the next stage. One thing we know is that Newcastle disease is an endemic disease. It has come to stay. I'm sorry. I don't know whether it's still a notifiable disease because once the disease becomes endemic that it cannot go. I don't know what you are notifying. Everybody knows about it, so it's notified already. Anyway, Lawal, describe yourself and then we'll move on.
Good morning, colleagues.
Please, I think you have to. You have to. It's echoing.
Okay.
Why making it echo? So block it.
Okay.
Okay, continue.
So, I'm Professor Lawal Saidu, a professor of avian medicine, and we have been trying our little way, and up to this level. I think that is the best description I can give myself. I work here in Ahmadu Bello University Veterinary Teaching Hospital. Yes. I think, Charles, I have introduced myself.
Yeah, thank you very much. You can continue.
Okay. As Charles has said, Newcastle disease is a highly contagious disease of many species of birds. In fact, it affects almost all orders of birds, and it is caused by paramyxovirus, specifically paramyxovirus 1. A lot has happened. Before they will tell you paramyxovirus 1 to 9. Now they are talking of 1 to about 13 or so. And people are now talking of genotype, several genotypes of Newcastle disease, not even the paramyxovirus, but people are now going as low as the genotype. The disease is characterized by high morbidity and high mortality. Yes, you have high morbidity and mortality in naive birds, but in birds that have history of vaccination, the morbidity and mortality may not be very high. So the mortality and morbidity depend on the vaccination status of the birds, the age of the birds, nutritional status, and also the environment. The clinico-pathological signs can be asymptomatic, that is, without any clinical sign or very mild clinical signs. Then it can be viscerotropic, where you have lesions and intestinal tract involvement, and it can also be neurotropic, where you have nervous signs involvement. Mhm. Uh-huh.
Yeah.
Yeah. In the viscerotropic form, you have hemorrhagic diphtheritic lesions in the entire alimentary tract. In some cases, depending on the case, you see ulcers in the intestinal tract, particularly along the duodenum. You see hemorrhagic diphtheritic ulcerations, and there may also be hemorrhages in the cecal tonsils. You can also see enlargement, and you can, in some cases, see ulceration of the cecal tonsils. Then the one we really rely on, you see hemorrhages in the proventriculus. This one, every veterinarian knows is a pathology of Newcastle disease, but you can see it hemorrhages in the proventriculus in diseases like infectious basal disease, also in avian influenza, but is very common with Newcastle disease. The disease was first identified in Indonesia in 1926, and in Newcastle upon Tyne. It's the village where ships come and dock. And in 1927, there was an outbreak of a disease that was wiping chickens. Chickens were dying, and later it was identified as Newcastle disease, and that is where the disease got its name, Newcastle, because in Britain it was first recognized in that village in 1927. However, some reports are saying that the disease has been recognized as early as 1898 in northwest Scotland, when it wiped almost the whole fowl flock. The policy of slaughter cost in England and Wales on 31st March, except for the for acute Newcastle disease. You see, this policy, it ceased in England in 1963 because the disease has become endemic, and it is coming in form of epizootics, particularly in Europe. Yes. The disease is found out throughout the world. It's not that it is located in a particular geographic location. All over the world, all over the world, the disease is known, and the disease is common, except in countries, Australia. In some parts of Australia, the disease Newcastle disease is not found, but it is a disease you see all over the world, although it tends to be more severe in Southeast Asia and Africa. You can say underdeveloped world, but in the developed world, they have controlled the disease to some extent, but they are still having pockets of outbreaks of the disease. As I said, it has been controlled in Newcastle disease and in Canada and in some Western European countries due to the policy of test and slaughter. You slaughter to salvage. But it continues to be a problem in Africa, Asia, South America, and other parts of the developing world. Wild birds can sometimes carry the virus without becoming ill, particularly waterfowl. What do I mean by waterfowl? The geese, the ducks, and mallard ducks, and other species of waterfowls. They may carry the virus without showing you clinical manifestation. But the virus can infect other other avian species. For instance, in Jos in Nigeria, there is a virus we commonly use for research. We call it Kudu 113. It was isolated from a duck that is apparently healthy in Kuru. The duck was working, apparently healthy, not showing any clinical signs, but this virus was isolated from the duck, and it is highly pathogenic for chickens. It is an RNA virus. Is very important for molecular studies, particularly if you want to do reverse transcription test. You know that this RNA virus
Come and stay here.
microbiologists, the microbiologists, biochemists will tell you it is a negative sense, single-stranded RNA virus. But what is important is for us to know that it is an RNA virus. Transmission of the disease occurs by direct exposure to fecal and other excretions from infected birds. Yes, by exposure to fecal and other excretions from bird. But aerosol transmission is also possible. And that is why in the harmattan it becomes a problem, because the harmattan wind assists in the transmission of the virus. In fact, some other people will call it down hoda in Hausa, telling you that the transmission is by aerosol. Contaminated feed, water, equipment, and clothing all play a role in the transmission of the virus. Yes. Then you have several, as I've said earlier on, you have several strains of the virus. The first one there is the velogenic, which some people will say the mutatis form of the disease. This one produces severe nervous and respiratory signs, and it spreads rapidly and cause up to 90% mortality in naive flocks. If your flock is open, no history of Newcastle disease vaccination, you get high mortality as a result of this strain. Then the second one is the mesogenic strain, or we call them intermediate. They are intermediate in virulence. They are not highly pathogenic. And these ones cause signs like coughing, egg quality, and drop in egg production. And the mortality can be as low as 10%. Most of the vaccines, Newcastle disease vaccines, are produced using the mesogenic strain of the Newcastle disease virus. Then the third one is the lentogenic, non-virulent. They produce very little or no clinical size with very negligible mortality. A very good example is the Hitchner B1, which we popularly call IO. And a lot of them, they are all over the place. Okay. What are the clinical signs of the disease? What makes this disease spectacular? The lentogenic strain, they are usually associated with mild coughing, gasping, sneezing, and rest. So mostly you have respiratory signs which can be exacerbated by other agents, e.g., E. coli and other bacterial organisms or viruses. The mortality here, as I said earlier on, is negligible. Yes, then the lentogenic strains also produce mild respiratory signs and neurologic signs. But mortality rate is usually very, very low, except it is compounded by other infectious organisms. But as I said earlier on, most of the vaccines, Newcastle disease vaccine, are produced from this strain of the virus. Okay, then the velogenic strain. This is mostly what you see in the villages, particularly around October, November, December during the harmattan in the villages, in the village chickens and other poultry species is a very severe form of the disease. Mortality can be as high as 100, and
Good. Lawal, unmute yourself.
lethargy, the body will become weak. It cannot move. It stays in a place, and you have inappetence. The feathers become rough, and you have edema and conjunctivitis. The edema, you see, it can be severe swelling around the head, around the eyelids, and it can be very severe. In some cases, you see cyanosis of the comb and wattle. Uh, wattle, yes, in some cases. And as the disease progresses, you may see greenish white diarrhea, and you see inflammation, as I said, around the facial edema, if I can use that word, and you see cyanosis of the head and what else. Then at later stages, you see tremors, nervous signs, tonic or clonic spasm, paralysis of the wing. The wings will be dropped. The legs too will be paralyzed, and then you see torticollis. You see torticollis, you see uncoordinated movement, birds moving backward, and this prompts some people to call it ciwon hauka because you see serious in coordination. So the Hausa man in the village just called it ciwon hauka because the bird behaves as if it is mad. Aha. This is where it comes. You have sharp drop in egg production. And this is why most farmers are abusing Lasota, because once they see drop in egg production, they believe there is a problem with Newcastle disease. The next thing is you go in and vaccinate. But you see sharp drop in egg production. The eggs are misshapen and abnormally colored. Some will be white. You see white egg, thin shell eggs. You see blood spots on the eggs. Then mortality may be sudden, but with no clinical signs. Birds that survive the infection will develop neurological and there will be partial or complete cessation of egg production. Yes. Morbidity and mortality, as I've said, maybe 100%. I'll be repeating this one in unvaccinated chickens, because if your chickens are vaccinated, if they are well vaccinated, the mortality will not be 100%. You may lose some, but it will not be like what will happen in a naive flock. And that is why in the local chickens in the villages, because there is no vaccination, you have very, very high mortality, sometimes approaching 100 or 100%. Yes. Uh-huh. Well, as I said earlier on, this photograph showing you chickens with twisted neck is a chicken infected with Newcastle disease, showing torticollis. The veterinarians will call it torticollis, but but maybe the farmers will call it twisted neck. You see, as if the bird is going into trench and out of trench. Well, sometimes once you disturb it, it bends the neck. But when the disturbance ceases, it can be normal, eat normal, drink normal. But once it is disturbed, you see it turning the head and moving backward. Yes, clean. Well, another one is opisthotonus. I don't know whether opisthotonus, is it the same with stargazing? Okay, okay. You see opisthotonus, the
Is
head downward, they bend downward, and in other cases you see stargazing. The body will be looking up like it is praying. The head will be up like the body is praying. I thought that is opisthotonus. Okay, let's go to the next one. Which one is the next one? Okay. One in the next. Okay. Okay, we didn't have the lethargy, the diarrhea, and other clinical manifestation in the pictures. But in some cases, they are the first signs you see. So the next one is post-mortem examination, post-mortem lesions. And the first thing, as I've said, almost all veterinarians, all of us know that in Newcastle disease, there is hemorrhages in the proventriculus, as is seen in this photograph. You can see the photographs, petechial hemorrhages in the photographs.
sorry, can you use your icon to show us the proventriculus, the hemorrhage area in proventriculus, the ecchymosis I'm seeing? Yeah, good,
Okay.
good.
The
Is
arrow,
ecchymosis? Yeah,
you can see the arrow showing the.
yeah, yeah.
Can you see the arrow showing the hemorrhages?
Yeah,
Uh-huh.
yes, yes, yes.
So you have hemorrhages in the proventriculus. Which one is this one? Then, as I've said, you can see green arrow there showing a large and hemorrhagic cecal tonsils. The cecal tonsils are a collection of lymphoid tissues at the base of the ceca. In Newcastle disease, they are infected and they become enlarged and hemorrhagic. You can see this, the green arrow is showing the hemorrhages. Aha. Then the next one is, you see, as Newcastle disease manifests with respiratory signs. So at pathology, at postmortem, you also see severe hemorrhages in the trachea, as pointed out by the green arrow. And then you see accumulation of mucus also in the trachea. So as the body is coughing, trying to get rid of the mucus, the body will be coughing. The body will be coughing. So you see, at postmortem, you see hemorrhages in the trachea, and then you see accumulation of the mucus in the trachea also. Aha, this is okay. In some cases, the ovarian follicles are hemorrhagic. They become severely hemorrhagic, as you can see here, pointed out by the green arrow. You can see the ovarian follicle. You can see hemorrhages. The tissue down is the oviduct. Oviduct. Yes, it is the oviduct. The tissue down is the oviduct. But what you have, the green arrow, is the ovarian follicles that is severely hemorrhagic. Then shikenan. Okay, okay. Then okay. Hello.
Yeah, continue. Sorry. We had
Okay.
a miss.
Okay. Having seen the clinical signs, having seen the postmortem lesions, then the next step is diagnosis. How do you diagnose this is Newcastle disease? Because it's very, very important. So, so the tests are many. The first one there is immunologic, eh? Immunological tests. These are tests that will show you the antibody response of the bots. Here you want to measure the antibody response of the bots. You can also measure the presence of the antigen. The first test we have there is the enzyme-linked immunosorbent assay, ELISA. ELISA is highly sensitive, and is highly sensitive, very good. It will detect level, even very, very low levels of antibodies in the serum of the bots. So we use ELISA. The gold standard is hemagglutination inhibition test. This one is also a serological test that will measure the level of antibody of the bots. It is based on the ability of the Newcastle disease virus to agglutinate chicken red blood cells and other mammalian red blood cells. And for a very long time, it has been the gold standard for detection and diagnosis of Newcastle disease. You can also do heme agglutination test. The heme agglutination test will tell you the presence of the antigen. It will tell you the presence of the antibody. You can also do antigen capture ELISA. The antigen capture ELISA will give you the presence of the antigen also. Even quantify it. You can even quantify it. The second one is molecular technique. Molecular technique. for viruses that are for viruses like Newcastle disease, influenza, you use what they call reverse transcript PCR, RT-PCR. This one, you detect the presence of the gene of the virus. Is as good as viral isolation, because once the genetic material of the virus is there, once the RNA is there, you can detect it. You have to do the reverse transcription because it is an RNA virus. But if it were a DNA virus, you go straight and do a PCR direct without the reverse. This one you can also do quantify. You can do quantitative, several type of RT-PCR for the diagnosis of Newcastle disease. The biochemists and veterinarians interested in molecular biology will tell us a lot on this one, but it's very good. And this test too has also given us the opportunity to know which genome, which genotype of the virus is circulating in your environment. And using this test, several people have shown that there is a difference between the infecting virus, the virus circulating in the environment, and also the virus we use in vaccine, which maybe is responsible for the problem we have in controlling Newcastle disease. Then the gold standard, super gold standard, is viral isolation, because once you isolate the virus, case closed, case closed. You have done it. You do viral isolation. You isolate the virus in embryonated chicken eggs. In some labs, they will tell you to use specific pathogen-free chickens, the eggs from specific pathogen-free chickens. You get it in most labs all over the world. It may be very difficult in our environment, but Dr. Shitu and others in NVRI are trying. They are trying their best for viral isolation. You do. Yeah, you do a lot they are doing a lot in viral isolation. So the samples you take for viral isolation, uh, you take the swab of the trachea, and you also take the swab of the cloaca. There is a difference between the volume of viruses excreted in the trachea and in the cloaca. So these are the samples you use, and you transport the virus in what they call viral transport medium, so that you don't want to lose the virus along the way. You can also isolate the virus from the lungs, brain, spleen, liver, and kidneys. Yes, prior to shipping, you have to, as I said, you don't want to lose the virus. You have to refrigerate your samples and transport them in Coolman jars to your lab. Eh? Okay, prevention and control. Now this is where we the veterinarians become very important. You have diagnosed the disease, you have known the disease, and you know the disease is a viral disease. So how do you control it? How do you control it? Initially, they will tell you to isolate infected birds immediately. But in Newcastle disease, where morbidity can be almost 100%, who are you going to isolate? This may not be tenable. Then, for those of us keeping local chickens in our backyards as a hobby, any new bird, you both should be isolated and vaccinated before you introduce it into the flock. Because, for instance, I know of somebody who lost all his flock simply because he bought birds from a local market and mixed them with his original flock. Before you know it, Newcastle disease was in spreading in the flock like wildfire, and most of the birds died because, as I said earlier on, they were naive, they were not vaccinated. So if you buy new birds as a hobby, as an interest, or you don't want to raise the improved chicken, fine, but you must isolate it and then vaccinate it against Newcastle disease before you introduce it into your flock. And then if you have an eye bird, also there are several vaccines, but you should, if for nothing, you should not give it Komarov because it is naive. If you give it Komarov, it's like setting petrol on fire. So you use the mild vaccines first. They will do it. Then there are several vaccines against Newcastle disease in circulation all over the world and in Nigeria. You have the live vaccines, Lasota, IO, you have Komarov, you have I2, V4, and several others. All these are live, in most cases, are live vaccines that you administer in water or you administer in feed or whatever, because like the V4, the I2 are usually administered in feed, particularly in Southeast Asia, and they have been very effective. Then you have inactivated. The inactivated vaccines we usually call them killed or oil emulsion vaccines. You have Lasota, killed, you have Komarov, killed, and you have combinations of several vaccines. For instance, the popular 3-in-1, that has infectious bronchitis, Newcastle, Komarov, and egg drop syndrome. Or the 2-in-1, you have Komarov, you have egg drop syndrome, and several other combinations in the inactivated vaccines. Then you have recombinant vaccines. As I said, this may be veterinarians that are interested in genetic engineering can tell us more about these ones. But this one here, you have a large virus, and you introduce the genome of another smaller virus, and then you can use the same vaccine to control two diseases. For instance, fowl-pox vaccine, and then Newcastle disease, because the pox is a large virus. You can introduce the genetic material, the genome of Newcastle disease virus, and you can use it to vaccinate your birds. And several vaccines are available. Even currently, people are using the in ovo vaccination and other things. Yes, then a thymotolerant vaccine. or thermostable vaccine, as I have mentioned some of them earlier on in discussion of the live vaccines, where you have the vaccine is thermostable, very good for the villages. You don't need electricity. You don't need refrigeration. It can withstand room temperature. In room temperature, you keep the vaccine in room temperature, and then you administer it either in the feed or in water. In Southeast Asia, where rice is available, they use it, they administer it through rice because rice is their staple food. Here we have tried several means of administering the vaccine, like corn bran, wheat bran, and other brands, and we have gotten some reasonable results. But despite that, the water route of administration give us better result, and is very good, at least for the villages, at least for the control of Newcastle disease in the villages. Because why we are having problem controlling Newcastle disease is we are concentrating on the improved chickens and neglecting the village chickens. And if you want to control Newcastle disease, the beginning point is local chickens. If you control it in local chickens, you will definitely control it in the improved chicken. And unfortunately, also for us, you have improved chicken, you have a flock of local chickens and other poultry species roaming in the same environment. And by the time the disease comes, it will wipe out your local chickens and then get to the improved chickens. It may not wipe them out, but you lose money because in the course of the disease, you lose eggs. If you are the egg producer, if you are a meat producer, your birds will not gain weight very much. Ah, we have been talking about chicken. Yes, unfortunately, this disease is a problem in man also. It causes conjunctivitis, and although the condition is generally mild and self-limiting, but those of us handling the birds, handling the vaccines, and other things should be careful. Angama? Angama? Angama. Thank you, sir.
Professor. You can see if Lawal is a professor. Yeah. I don't want to engage you whether you are a professor of avian medicine or a professor of poultry medicine, which is a subsection of avian medicine. So that is a discussion for another day. And we'll make our discussions to be very hilarious. We'll make our discussions to be, in a happy mood. We're here on a happy mood. We're not here on a moody mood. We are not chasing the world. We are not looking at the fuel prices as we make our discussion. We are not looking at the student and our children's school fees. And he made a lot of points. I want to see what I can do at least to break down some of his points. That like the Opisthotonus he mentioned, stargazing in chicken. Most of the effect is that for the village chicken I've seen, I mean, I've not seen it in an exotic birds, but I've seen it in village chicken. And
Yeah.
where they mispec their feed, especially corn. They will go and
Yes.
peck in the ground instead of pecking which means the vision is that was a resect. There is a resect of vision. It's a seeing a wrong vision, apparent vision, and then that is what I believe. So instead of pecking on the corn, they will miss the corn and be pecking on the ground. That's one of the effect of opistotolus. And then the water route of vaccination, we have to be extremely careful or you do the wrong thing. The water supposed to be chlorine-free or antiseptic-free or disinfectant-free or rust-free, using rust materials that are capable of being rusted, getting into rusting, like metals, using them to give birds water. Like Lawal will know, I've handled birds at parent stock and at commercial level. And especially, and when we are talking about Newcastle, you have to have a vision, especially those who are keeping layers, they'll keep for a long time, how to handle Newcastle. Newcastle is highly endemic. It is clinically wrong for a farm to have 100% mortality. That means they don't have a plan. You know, the vaccination schedule you have to put in place has to conform with the endemicity of birds, of the ecology where the birds are being kept. You can't have the same vaccination schedule for birds in the north, where you have dusts. Harmattan is so obvious, carrying this virus from one place to the other. And those of us in the south, mostly you see those that grew with local chicken. You see those Newcastle, these Newcastle signs during the Harmattan period, which is very short period than in the north. That will tell you the high endemicity of it. So you don't create the same vaccination schedule when in the rainy season, in the dry season, and in the Harmattan. That is a dry non-Harmattan season and dry Harmattan season. They're supposed to have a different vaccination agenda. And when we are dealing with water vaccine, the vaccine should be free of contamination, not even antiseptics or chlorine, any contamination. And then there are stabilizers you use to keep the virus, because these are live vaccines, to keep them alive. And there are commercial stabilizers, and the best we can get here is not oat milk. Is a skim milk. Skim milk is skim powdered milk is different from skim unskimmed powdered milk, because the unskimmed powdered milk has fats in it. What do you call maishanu? Is it maishanu? They have maishanu in them. That is oil in them, fat in them. That is not the one. Is skim milk. And then, if you are using, I started by practice. What we advise the clients to do, if they are using, because every tap water is chlorinated in terms of making the water sanitized. So what we advise them is open boil. You boil the water, open boil them for 20 minutes to boil out the chloroquine. The chlorine. So these are things, because if you do the wrong thing, the best is not as good as vaccinated. And then another thing we normally do is to tell the client, even when in my farm, stop them on water overnight, so that they will be tasty. So immediately you put the vaccination around between 7 and 8 o'clock, they will rush the water. They will all rush the water and get almost the same quantity. Yeah. So that's certain things I really want to. Then coming to the recombinant vaccines, the two types of them, the gene deleted. That is, you delete the pathogenic genes, the genes, that is the area in the genome that is pathogenic, and then keep the unpathogenic area. And keep the antigenic genes, the spots that can give you the antigenicity for protection. it's been found that the pathogenic area is not antigenic. So once you delete them, what you are having is a non-pathogenic genome. You know, in birds, we call it genome. In other areas, we call it genes. But another area is to get fowlpox, which is a vector, which is a vector, then I start transcribing genes meant for immunogenicity from other entities. You can be Gomboro, you insert. That is, you pull that whatever the portion of the genome for antigenicity for Newcastle and insert it. The other one is you delete and you don't insert, but the second one is to pull out and insert in a genome that is, like he said, that is broad and big, whereby you can insert certain components of other entities that will make it antigenicity. That's why you have a recombinant Gomboro and recombinant Newcastle in the same vaccine. And then the fowlpox also, which is the parent genome which you are using. But one thing is that it is very sensitive. You can only store it in liquid nitrogen and some sensitive environment. If you don't have hatchery that have all those facilities, vets, how many of us have nitrogen, whatever, carriers, flask that you use in carrying vaccine one place to the other? Maybe the hatcheries can have that and vaccinate at source. But for other areas, it's almost impossible. And when we are discussing practice like this, we are not going at academic. We are going to what can work, the plausibility of it working in the field, so that it doesn't become nebulous. You know, there are some academic exercises that if you pull it and put it in a place, it might not work. So this program is for practitioners who will practice in the field. This is not an academic environment. So whatever we're teaching here is what works with you in the field. And now he talked about the Kumaro vaccines, which is true. You don't give birds you don't give unprimed birds Kumarov and inactivated vaccines. Most inactive, not all actually. Most, yes, because the priming for Kumarov is for you to boost the immunity. Being that the mesogenic strain of Kumarov of vaccine can cause infection, sorry, the velogenic strain can cause infection, can cause clinical infection. So you need to boost the immunity so that it will not be able to give you the clinical infection. And then the inactivated vaccines actually is that you prime them and put the memory cells alert so that when you vaccinate further, things it will work. That means you prime with live vaccines. So when you give inactivated vaccine, though there are some inactivated vaccines now being developed, you can give a day old, but there are not many. First of all, the ones I have seen in this country, you have to prime the beds. Once you prime the beds, put the memory cells alert. Once you give the beds the inactivated vaccine, it will work. Anyway, please, I'm talking as somebody in the field. I'm not talking in the lab. All these PCR, reverse transcriptase, we'll be watching them, whatever they tell us to do. We are zombie to that. It's like what they say, stand up, we stand up, sit down, or we sit down. Thank you, Prof. We will call you again later for other discussions in poultry medicine. And this is the second time you are giving us a lecture. We'll continue calling you. And one thing I'm happy with you, anytime we call you, you answer us. Continue to answer us because, and then I will talk to young minds, those coming up. You need to learn. That's why we're bringing up all these topics so that you can learn and being able to grasp the nitty-gritties. I have seen a situation whereby birds are vaccinated. You see fecal samples in the water, the drinking water. The reason, we talk practical. Somebody like me. Reason they put the drink on the ground, though. If you really want to vaccinate pets, measure the neck length and put it up so that you can drink. No, not on the ground. Because the more you raise it, the more it will the more it's difficult for fecal materials to contaminate the water. So these are things you will study. You don't study it, well, all you tell you in school is vaccinate, do this. Practically, most times, you might not see some of these things in the clinics or in where you are trained. But when you come out into the world, you see the real thing. So you have to continue being with us so that we'll be able to be talking to you, giving you the grasp of the field, so that when you see it, you know what you can do. Just like this one I'm talking about vaccination. If you put your drinkers on the litter, the litter materials will fly into it. They will defecate inside it. So you put your drinking your drinking material, your drinkers, you put them at the level the fecal material will not enter into the water to contaminate your vaccine. The litter materials, using wood shaving or sawdust or what, will not be able. And when we advise, when you are giving your vaccine, give at a time you have a new litter, wood shaving, so that the flight will not be much. If you make it dusty, like as birds are defecating, you know, it has uric acid, which is the urinary component of the physics, the fecal material, will destroy your vaccines. Uric acid will destroy your vaccines because birds, what they pass out as nitrogenous waste is not the urea, the uric acid, which we all know the reason why. It's just for water to go back into the body. But that is not even the issue. And then you're allowing those fecal materials to enter into your water, which you are used to vaccinate your birds. I'm telling you, it's not good. And then you're having the dusty, because as the uric acids are destroying the wood shaving, they're turning into dust. And as they are turning into dust, the likelihood that they will be flying, those dust will be flying about as that, you know, they're going to struggle for water because you starve them of water is high. And that means, and those dust has uric acid. So you need to clear your litter, put brand new shaving material, raise your drinkers to the level they can drink, so that you will not be able to do the wrong thing. I think I've seen one Professor Victor Sincalo. I have not met him before. Where is he based? So that we are continuing. So you can, questions are coming up. Let me see the chat box. Please, Lawal, check in. Yes, prepare your question. I've said it. Yeah. So I said, thank you, Professor, for your. Okay, please. Lawal, all these things I said, do you have anything to say on top of it so we can continue? Dr. Lawal, Professor Lawal. Very good. Professor Lawal, has it crashed out? So thank you, Prof, for your wonderful presentation. What is the best way of managing Newcastle disease after confirmation? Sorry, my network fluctuated. Okay, Lawal can take it on. Lawal can, but in this endemic area, what I normally do is to vaccinate with Lasota. That's what. Vaccinate once you notice. You don't even allow a proven Newcastle to come. As it is been, if you have been with birds, you know it's when it's about to strike. Like laying birds. The first thing you see, which Lawal said, is the colorization of the eggs. Once you start seeing the colorization of the eggs, if you allow it to go beyond that, you might enter into the classical science. So what we do in our farm, in farm, is to vaccinate them with the milder strain, and then you see them return back. But Lawal should talk on that. Lawal,
Mm-hmm.
can you talk on that? Someone talked about when he strikes. Sorry, when he's about to strike. He talked about when he strikes, but I'm talking about when he's about to strike. What do you do?
When the outbreak of Newcastle disease, it's very difficult to manage, but you can manage it. The first thing is to, I don't know, is to start with antibiotic, mineral, multivitamin stroke minerals treatment to boost the immunity of the birds. The second thing is what you say. You boost with Lasota. Fortunately for us, a lot of experts have shown the advantage of vaccinating with Lasota in the outbreak. In other diseases, you are not encouraged to revaccinate during the outbreak. But in Newcastle disease, you are encouraged to vaccinate during the outbreak because according to experts, there is a competition between the mild virus and the vaccine, the wild virus and the vaccine virus. And the vaccine virus is able to compete better than the field virus, and that way it will protect your birds, and then your birds will recover. The recovery period may take long, and you lose money, but it's a disease you can control, and with a lot of water sanitizers, and you use pro and prebiotics, the effect of the disease will be reduced. But one fact that is clear, we should bear in mind that this is a viral disease, and anything that will kill the virus may also have negative effect on the host. Although now I've seen veterinarians using Providone iodine, and they claim it works for them. If it is so, then that is also excellent for us. But is you can only manage it. You can only manage it. No effect, no treatment. Mostly we rely on multivitamins and revaccination. The idea of the Provident iodine that is coming in recent years is a welcome idea, but it's very difficult to manage an outbreak of Newcastle disease. Thank you.
Yeah, I think to just in continuation with what you said, I always believe that any good poultry vet that is observing birds should know when it's a strike. It's just like my malaria. I know when my malaria, I mean, after suffering malaria for close to 65 years, I know when the full-blown malaria will come. I know the little signs it will give me. And if you strike them down by drinking the drugs, you won't get into that stage. And I think the same thing with Newcastle. If we live in it, inside it. If you have, let's say, you are rearing birds and started noticing signs of cough, dry cough, not the kind of cough you have in CRA, productive cough. I talk about dry, call it non-productive cough. I think you're about to get there. And that's what we do in our farm, and we're able throughout years, how many, for 10, 15 years, 10, 12 years, we were in poultry. From parent stock down to commercial layer, we didn't have full-blown Newcastle. Upon all our vaccinations, they will strike. But one thing about vaccination, if they're striking with difficulty, before they come in blown up. And when you see signs of torticollis, which is the end sign of Newcastle, you are having maybe 1, 2, 3% mortality. That means your vaccine is working. But when you're having every place filled up with torticollis, because torticollis is when they're resisting and resisting. You know, if you see those birds, it's only hunger that kills them all, not the clinical sign. Because you see a lot of, they will be struggling to survive. And one thing I found out when I was young, because I grew up with local chicken, there was one with torticollis, with everything. It was able to solve the clinical signs, the greenish yellow diarrhea. It was able to survive. Do you know that bird stayed, before it died, that bird stayed over 5 years later. So before we were able to slaughter it. Because once they survive, the ability to get back the disease is very difficult. Because of the
Yes.
because of the immunity. Because of the natural immunity. The ability to come back on that is very, very extremely difficult. So, but if you manage your birds, but one thing about as your birds are coming, their immunity is good. With the exotic bird, what I find, the immunity is waning. So that's why when they start waning, they start seeing some signs that looks like signs of Newcastle. Then you vaccinate them, they will come up. They will move beyond that stage. Thank you. Say again. Please,
Yes.
Lawal, I'm not collecting words from your mouth, trying to expand from
No,
the in the
it's
field.
okay.
So talking about the decolorization, how do you differentiate it from eggs from almost spent layers? Lawal, you can. Lawal, you can.
Yes, I like this question because fortunately for us in Nigeria, most of our eggs are brown. In
Yes.
fact, people don't like white eggs. Although I see no difference between the two of them, but people don't like them. So because the eggs are brown, if you have eggs tending to light brown, if you have white eggs, if you have soft shell eggs, you see, in fact, the discoloration is very easy to detect. But if you have white eggers, then it may be a problem. But with the brown eggers we have, it's very easy to detect the discoloration. But the first thing you see is you see discoloration, you see your eggs tending to white, you see soft shelled. In fact, in some cases, the shellless eggs, and then you may see blood spots on the eggs will be brown, but with
What's going on? What's going on? We're not hearing you, sir. Dr. Lawal, are you with us? Ben Onoja, are you hearing us? Is there any problem? Hello?
I can hear you, Chief, but I
I
can't
can
hear
hear
Prof
you, no
anymore.
problem.
How about Lawal? Well, are we hearing Lawal? Is it crashing
No, we
out?
can't hear Lawa again.
Lawal, unmute yourself now. Lawal, unmute yourself.
sure. I've
Yeah.
done that.
Yeah. So, okay, continue. I think in addition from what Lawal said, it is not over. Discoloration is not whitening.
Okay.
That's the thing. It is not whitening. We know the color of brown eggs. When you start seeing it reducing in color, it's not the thread is not bleached. It's not that the
Okay.
eggs are bleached to white automatically. It takes a gradual process from
Yes.
brown egg, the contour, to a less brown, and it continues like that. So it's not that the birds just came up and start producing white eggs. No. And it is scanty in them. It's some very few percentage that you will
Yes.
notice. So
Yes.
that when you vaccinate it, they will come up. The ones that are about to enter will come up. Even the ones that are producing that less brown eggs will come up. By the time you allow it to go into the white phase, where the eggs are brittle, they are soft, the shells are soft and brittle, my brother, you are entering into the full-blown stage of Newcastle disease, which you should avoid. Are we there?
We are.
Yes.
Yes.
Am I making sense?
You are.
Good. Thank God. So, who is Professor Victor Sinkalu? If
Victor
there's a
Sinka is based in ABU.
okay, I don't know him. Or we
You
have not met.
he is much younger than you.
Anybody that is older than me, anybody that is older than me is very old.
Yeah, so I'm not only younger than the presenter, he's my academic father.
Okay, good, good.
Yes, sir.
Are you in hiding? You're supposed to be in Kaduna. Kaduna Vet is supposed to be in Kaduna by now. Because after this,
Yes,
yeah.
yes. Before I speak, I want to thank the chairman, moderator, and the presenter. Actually, the presenter has been my academic mentor since undergraduate days. And I became MSc and a PhD in poetry under his tutelage. So I hold a PhD in avian physiology
Okay.
with his mentorship.
Yes.
So
So
all I need to say is I'm happy to be here. I've followed closely. I couldn't move to Kaduna because we are writing mock jam exam today. So I'm locked down. Otherwise, I would have been in the entourage of the presenter. Thank you very much and God bless.
okay, thank you. So pray for him to become vice chancellor. We've been seeing
Okay.
we've been seeing his name as a contestant. Let us see his
Yes.
name as a winner next time.
Yes, yes, I'm sure he will tell you that even the last one, I was one of his foot soldiers. But God's time is the best.
I hope you are not the problem. So at times, food soldiers can be the problem. Maybe they will change you. Do you know I'm a veterinary politician? Do you know?
Okay.
Do you know? I was
Yes.
MVMA president. At times, I change my food soldiers when they are becoming problem.
No, no, no. I'm loyal and reliable.
I know you are reliable. I thought we can. People look at food soldiers to vote before they look at the other people.
This one is tested and trusted.
Oh, no, sorry, Prof. This is a lighter mood, though. So we don't insult people here. We play with words so that it will not be insult. To make it more hilarious. When we started, I said we are going to make this session very hilarious. And I think we made it hilarious. If there's any question, somebody said 2,000 beds. Somebody said 2,000 doses. So, somebody said, do you use 2,000 doses to vaccinate 1,500 beds? What do you do? Because some of the vaccines are 1,000, even 2,000. What do you do?
It's a very dicey situation.
And I'm
But
dodging the question.
I know somebody that lost his 500 6 weeks old pullets because he used 1,000 doses to vaccinate the birds. Although experts will tell you the vaccine has been passaged, and with the number of passage, the virulence of the virus is reduced, but it's still not safe to use to increase the dose of the vaccine up to doubling the dose, because there is likelihood of these vaccines viruses reverting back to virulence. And if you increase quantity of the virus you are using instead of the recommended quantity, you are creating more problem, and it's more likely you will run into problem. Instead of increasing the dose of the vaccine, what some I know what some practitioners are doing. If they have 1,000 layers, adult layers, they want to vaccinate them, they use 2,000 doses because to make sure everybody gets the vaccine. Instead of increasing the dose of the vaccine, is you should look at the dilution factor and increase the dilution so that everybody gets the vaccine. It is recommended that if your birds are adult, you give them 40 mils of the vaccine instead of the 10 mils we give young pullets, so that you increase when you use 40 mils, you increase the chances of everybody getting the vaccine. What do I mean? If you have 1,000 doses times 40 mils, that will give you 40 liters. That will give you 40 liters. And with that, you are comfortable instead of using 2,000 doses. And a lot of people are doing it, and we are in trouble. Particularly here in Zaria, we have experienced people overdosing the chickens and losing the chickens due to Newcastle disease. Somebody had 100 broilers. He vaccinated them with 200 doses of the Lasota vaccine, an imported vaccine from somewhere. And before you know it, he has lost all the birds. Well, out of 100, he lost only 7 were left. Only 7 or 8 survived. And you want to protect your birds. You end up losing your birds. Is economically not good. So people should be wary. People should be careful about increasing the dose of vaccines. Under no circumstances you should increase the dose of the vaccine. It's also not good, but it's safer to reduce the dose of the vaccine than to increase the dose of the vaccine.
I think this question you can take it from the part of diluting the vaccine. It's 2,000 vaccine is talking about, and it's talking about 1,500. That's 2 vials of vaccine. You just dilute the vaccine with small, maybe you dilute with 10 ml before
Okay.
you remove it half, remove 5.
Okay.
Use that 5,
Okay.
5 ml, join it with 1,000 and do your vaccination.
Okay.
You
Yeah, that is
don't go
that is
beyond 105%, please, in your vaccination schedule. You can get 102% to get extra bed, maybe 1 or 2. But percent, don't go beyond 105%. That is what personal advice from my clinical experience, from my beds.
that is yeah.
Uh, so who again? Is there somebody ask a question right here before we're almost rounding up?
Okay.
Thank you, Prof, for this opportunity to learn. What could be the reason? What could be the reason why birds come down with Newcastle disease despite serological reports of antibody titer being within the protective age? So what's the reason behind the breaking of the virus in it? Is it because it's super virulent or whatever? Let's hear from you. Lawal.
I'm hearing you.
Yeah.
Yes.
Because I've not really tied personally in my farms, we have not tied the best to know whether they are protective or not, but we know that they are protective. What is the best?
So, depending on the number of birds, the farm size, I always advise farmers to determine the titer of the birds before vaccination. Uh, you can't tell somebody with 200, 500, even 1,000 birds to have a lab in the farm. But we have a lot of poultry laboratories all over the place now. It will be better to tighter the birds before you vaccinate. They may charge you, but the cost is minimal. It's cost effective when you compare to vaccinating the birds as we do, because some farmers now, every month they will give the chickens lasota. Every month they will give the chicken lasota. Every month they will give the chicken lasota. It is recommended you give the birds layers lasota after 12 weeks. This may not hold, based on our environment. So instead of just vaccinating blindly, why don't we determine the titer and vaccinate? If you go to the immunologist, they will tell you it takes you some days before your birds get to the peak titer. And when the birds get to the peak titer, it will stabilize at a level before it starts getting down. So you have developed the titer to a level, it stabilizes before it start falling, you introduce another vaccine. So you are starting the process all over again. So it will be better if you can tighter the bus. It's very difficult now because the ELISA thing has become something. But even if the ELISA is not affordable, the HR is a very simple test. You need minimal laboratory equipment and you need minimum time. In 2 hours, you can finish it and the client will get his result. So it's better if it is possible to tighter the bus.
So,
If it's not,
okay.
then
Before we come,
if it's not
before we
possible,
come to another,
no, if we cannot do it, we go through your system where you start looking at the discoloration of the eggs to know that yes, most likely Newcastle is coming, and then you introduce your vaccine.
now we have two questions here before we'll call in on Noja. What is the best?
Sorry,
We
sir.
have, yes.
Sorry, I don't think my question has been answered yet.
Okay, what is your question?
Okay, antibody titers
Yes.
for this set of birds were within normal protective range, but the birds came down with Newcastle. So is there a problem with the laboratory report, or what could be the cause of the outbreak despite the laboratory report? Is there anything that can predispose birds to the outbreak despite antibody titers being within protective range? And should I vaccinate? Should I vaccinate when antibody titers are still within protective range?
No, they say
That's just what I want to find out.
yeah, two things here. There are two things here. The sensitivity of your lab work should be paramount.
Yes.
He says, Prof, you said what?
I said the sensitivity and specificity of.
Yes, one. Then number two, what is the uniformity of that titer in the flock?
Uniformity.
Lawal, what are you saying, sir?
Yes, it's correct. Yes, I'm with you.
What is the uniformity? Because I have vaccinated Gomboro. I knew my birds are beautifully covered. But in a flock of 4,000 then, I saw 2, 3 birds that had signs of Gomboro. And when I opened it, you know where we normally go is the buzzer. I saw clinical pathognomic signs of bursar disease in 3 birds out of 4,000. That means something. You know, when you are giving birds that have a long, sorry, when you have that are large and you're giving them vaccine, there are some that protect and some not protect. So you can get those protected. Okay, in that my flock, maybe I got those protected and I have the titer level is high. But among them, there are some the titer level is low. So the question I will ask you, what is the percentage? Dr. Jasper, what's the percentage?
Okay, sir, I'm on a farm with over 200,000 birds. Yes, and in this particular pen,
Okay.
we have 20,000 birds.
Okay.
So we collected the blood. We took 18 samples as recommended by the lab, and it was actually CHI lab Ibadan. That this is a lab that you can actually depend on.
Yeah, just continue. Strike your question. We don't have time.
Yes,
strike
that did the serological, the
so
serology.
what is the percentage when the clinical signs came, the clinical aspect of the disease came? What is the percentage of those affected?
Let's say about 5%.
So why are we 5%?
Yes, sir.
It would have been 100%. And probably those 5% are ones that they don't have the titer there. That's what we are talking about. Uniformity.
Yes, Chairman. The problem is if you take samples to the lab, they will give you average antibody titer. Unfortunately for him, out of 20,000 birds, he picked only 18 birds. These 18 birds will not give him true picture of what is happening in the flock. At least he should have gone to as high as 10%. If he picks 10% of the flock, they will give him a different manifestation. And then the titer also depends on the test and the sensitivity of the test. But what is most important is most of us after running the lab work will give you an average antibody titer. And if the percentage of the flock is not representative of the flock, so also the titer will not be representative of the flock. Then you have what you call the protective rate. You have the minimum protective rate, which will protect your birds from drop in egg production, but will not protect them from mortality. So even the protective rate, it has to be within not the minimal, maybe the median. The median range will give him a better range. So within the range is wide, and and the one at the bottom, low at the bottom of the range will certainly come down with mortality and drop in egg production. So it's always better to aim at a higher antibody titer. My advice is, since his farm is big, he should have a mini lab in the farm. And he increase the percentage. 18 birds out of 20,000 is not fair. It's not fair. It will give you not good result. Let me use this English. It will give you not a good result, and it will mislead you.
Professor Lawal, I think we have done. Onoja will allow you. Let's take some questions. What's the best Newcastle booster practice in layers? Is it give monthly Lasota or give injectable Komarov? I don't. He didn't say whether live or killed killed inactivated colon. I will advise you don't vaccinate live Komarov with birds in lay. Don't try it. If you try it, you're going to have some subclinical signs, which include acute egg drop before you start working on it.
But
Now,
Dr. Charles, there's a lot of argument when you come to the booster, because some people are arguing why should you use Lasota to boost Komarov after you have given the boss Komarov? You are now coming to give them Lasota as a booster. And we have been telling them not to use live Komarov, as you have mentioned, but some of them that can afford, if we use the killed Lasota but oil-based, we get better and longer lasting protection.
yeah.
So people can afford.
Live vaccines don't protect more than 12 weeks, as far as I'm concerned. So the best thing, apart from Komoro, the next chain of revaccination should be inactivated oil vaccines.
Okay.
That's from my, what I'm talking from practice I've done with other farms before I set up my farm. When you, as a scientist, you do this, you'll be able to know the best. The inactivated lasts for a very long time. Then,
particularly, we don't use Komarov, but the killed Lasota gives you longer lasting immunity. The farmers are
Prof,
because
Prof, listen, no. We have taken this argument internationally. This killed because I belong to World Poultry Veterinary Association, which I have attended conferences in Egypt, in Denver, Colorado, in Edinburgh, blah, blah, blah. Killed products are not active products.
Okay.
They can't on their own give you disease.
Yes.
Because they can't on their own. Their gra-gra. You have cut off their gra-gra. Is the immunity they will give you is what you want. And then because they are applying it with an inactive in oil medium or media to be able to give you your immunity, that's all you want. Yeah, that's all you want. Then the last, before Ben will talk and then we'll end up. Birds are coming down with despite vaccination, and I'm sure it is not a vaccine failure from my end. I vaccinate meticulously and professionally as a vet. Let me say this. I started my practice immediately after youth service as an ambulator. There are certain things at my starting point. I was worse than as time goes on. I continue my near perfection is not a day's job. You are a vet, you come into the field, does not give you the be all and the end all. You need to read, you need to research, you need to walk, and you need to think, and you need to rethink. If I ask you now your vaccination strategy, if you vaccinate birds today and vaccinate next tomorrow, some of the diseases you are knocking off the antigen. Sorry, you are knocking off the antibody. You are knocking off the antibody. So it depends on what you call your strategy and your meticulosity. These are things that will guide you. The toga, I am a vet. This is an in-reach, actually. It's not for other consumption. This is not an outreach. The toga, as a vet, like me now, if I have case of bovine or cattle, only God knows what I will do. I'll go and mishandle it. Meanwhile, I'm a vet. Because I've not been in consistent practice in the bovine practice. It doesn't give me, or it doesn't author me to be so efficient like I am in poultry medicine. Because I have been into it, I've consulted farms, and I have been a farmer from the upstream down to the downstream. I've lived with the birds. Lawal I knew when I was living with 4,000 layers in Angwairimi GRA. And every day I'll be seeing a lot of things. And then I'll be correcting myself. So You said birds are coming down with Newcastle disease vaccination. And for me, I'm sure it is not vaccine failure. Then what is it? And from one, and I will tell you one truth. Most vaccines are not vaccines. They are placebos. How are you hearing me?
Hearing you.
Some vaccines from some spurious area ends, to me, are placebo. Then what is the handling from manufacturing to distribution to storage to vaccination from one stage to the other? You don't just go and pick up vaccine and say you are vaccinating. I don't do it. I don't. As a matter of fact, I don't. I know vaccines I will never use. I cannot use. I'm not that the vaccines are not good because I don't trust them. I don't trust the areas of the world where they are coming from.
So,
Lawal, am I right? Am I right?
you are.
So you are looking at yourself as a vet. You are looking at the product. What is the integrity of the product? The integrity of the manufacturers, the integrity of the distribution, the integrity of the transportation, the cold chains involved, and then the integrity of the vaccination. That's where your vetship comes into play. Now, Onoja, please, ask us, please, I think we've done a lot. Unmute yourself, Ben, and then make your comments, then we'll tidy up.
All right. Thank you, sir.
Allow me to talk.
Yeah, thank you, Professor Lawal, for the insightful presentation. What I want to say is I have two questions. One, Lasota is given as either IO for day-old chicks or in drinking water for more adult birds. Now, some people, some vets, they still give the Lasota as IO even to adult birds. What could be the implication of that? Two, if Lasota is given to layers at the point of lay, it has been documented that their eggs can have high titer of the antibody to Newcastle disease in their eggs, in the egg yolk. So that means it cannot transfer maternal immunity to the chicks, even for the next 1 to 2 weeks. So can we advise that the chicks will still be vaccinated IO at the point of lay, even when they have maternal antibody that can protect them for the next 2 weeks? Thank you.
Nagani. Okay, see. Dr. Onoja, are you
Yes,
with
sir.
me?
Yes, sir.
It's a very good question. One, you can give Lasota intraocular.
Yes.
You can give it drinking water. You can give it by injection.
Okay.
I hope you are. But giving
Brilliant.
Giving it intraocular to adult birds is a lot of problems to you, to the birds, and also to the owner of the birds. If you use IO, the whole idea of the IO is to stimulate local antibody production, and that is what it does. It stimulates antibody production at the cells along the Hydarian glands and along the mucosa of the respiratory tract. That is what you want to achieve. You want to achieve that. But in adult birds, with or your IO, with or without your IO, sometimes have been exposed to the virus in this environment. So always a waste of vaccine and a waste of effort, because you will not achieve what you want to achieve. That is the protection of the birds. The idea
Okay.
of when the birds are weak, they are young. Sorry, not weak. When the birds are young, you want to stimulate a local immunity that will lead to the production of memory cells and other things. But you have an adult bird that has passed that stage. So there is absolutely no point in giving the bird the vaccine intraocular.
Okay.
With
Yeah.
the high antibody titer in the eggs. Are
Yeah.
you with me? Yes, that is
Yes.
what it is supposed to be. You know, layers and breeders are passing the antibodies through the yolk. Whether you are going to touch them or you are not going to touch them, they lose the antibodies to Newcastle disease through the yolk.
Okay.
And that's why you have to repeat La Sota regularly in layers. The recommendation is 12 weeks interval. Now, you hatch birds from well-being parents. Go, they have
Yes.
high titer. Why must you give them IO?
Yes.
Why must
Yeah, you've said it all, Prof. The
there is to stimulate local antibody production.
production,
And
yes. When the immune system is weak, the other immune system is weak. So what you do is, yeah,
antibodies in Newcastle are not the same with the maternal antibodies in Gumboro. It's a different topic altogether.
yes.
So at the high maternal antibodies, you still give them the IO to stimulate local antibody production
Yeah,
because they are.
yeah, you've said it all. You don't give IO subconjunctile. We call it IO, but it's subconjunctile administration of vaccine for adult birds. You don't do that. But if you are afraid that all the birds will not get the vaccine, you better go for intramuscular.
Okay.
Yeah, if you are afraid, because the drinking water, some will drink, some might not drink, blah, blah, blah. If you don't have enough spacing, enough drinkers, blah, blah, blah. But if you move beyond that, you can use, but like this farm, this man is consult 200,000 beds. We will vaccinate tire. Anyway, they are in batches, in age batches, actually. But that's it. With automatic syringes, you can, it is advised to do that. If you know you might not get the water vaccination right, you can go for intra. But for using IO on that is supposed to be for young birds, it's supposed to give you local immunity from the Hadarian gland, that is just beneath the conjunctiva of these birds. And you know,
Yes.
at that point, the immune status, the immune organs are not so active when these birds are very, very young. So that's why we are
Okay.
using the local one. So as it's entering, it is producing the antibodies and it is being flashed into the blood, the
Okay.
bloodstream. Thank you.
Thank you, sir.
So Hayatuddin, please unmute yourself and make your comments and let's move on.
All right. Thank you for.
Prof. Lawal, don't leave me with these people. They will kill me. Don't go anywhere.
Thank you
They will
for
kill
giving
me.
me. All right. Thank you for giving me the opportunity. First, I would like to thank my mentor, my dad, Professor Lawal, for giving a wonderful talk on Newcastle disease. Even though
Are you in Ahmadu Bello University?
Yes.
A
Even though
lecturer
I
or a
joined.
student?
You said, sorry,
Are you a lecturer or a student?
a lecturer?
In avian medicine or physiology or biochemistry?
No, avian medicine.
Hey, okay, fire.
Yeah, I think Prof has said it all, but there is one thing that I think I need to say something about it, which is the confusion regarding having birds with high level of antibody titer, yet they come down with the disease. Second, the vets that claim or think that he vaccinated the birds properly, but yet they come down with the disease. I think one untouched aspect, which I believe you have talked about, is how recent are we regarding the current type or genotype that is available circulating in our environment. I think that really may tell us whether are we using the right vaccine or not. Even though he claims this is not a vaccination failure, but a lot of vaccination failure culprit are there. So we have to look at each and every one, which really can we pick up. Particularly in this context, I believe he think the vaccine, he sourced it from a reputable company, maybe a reputable source. But with the nature of our erratic electricity supply, I believe the antibody titer, as you rightly mentioned, that possibly we were given placebo instead of the vaccines. So I think this aspect need to be looked into, trying to connect between the field veterinarians and the academics to see where we can really have to find out what genotype, because now we have several of them, even though we believe Lasota still can do the wonderful job because it is an internationally accepted vaccine which can be given as a booster, but yet we do have such problem. Coupled with the vaccination schedules, we have a number of vaccination schedules, as Prof said. Some give vaccine monthly, some every 2 months, some every 3 months. So we don't have regular sero monitoring of our flocks, but yet we go ahead and vaccinate. Sero monitoring is quite important to establish a standard vaccination protocol for an existing farm. Look at a farm having 200,000 birds. Yet, they should establish their own vaccination protocol vis-a-vis the type and the source of their vaccines. I think this is quite critical. And again, the issue of vaccination at the midst of outbreak. This is a critical concern, which I believe internationally have looked at this, because we have to use our scientific knowledge. How on earth birds are already exposed to a virus which naturally they have to respond to defend themselves by producing antibody, but yet you think given vaccination will help. But in ideal situation, the highest recommendation is that in a farm with multiple housing, if an outbreak has been established in one particular farm, the best one particular house, the best thing to do is just to vaccinate only that house, to vaccinate the remaining house that are unaffected, not trying to give double dose of another virus to an already existing or exposed flock. And vis-a-vis other measures trying to give anti-stress and other supporting antibiotics to make them at least withstand the catastrophe of the vaccine. And also it depends on the level, on the outbreak, because you imagine some may just be having a milder exposure to maybe lentogenic strain or mesogenic strain, which they have already been primed with the vaccination previously, which not necessarily need another vaccination. That exposure alone can help them, if truly they are immunocompetent, to withstand and mount reasonable antibody. I think these are just some areas that I just wanted to add, even though I believe you must have said everything. Yeah.
Hayatuddin, let me throw some teasers to you.
Yeah.
I want to throw this teaser to you that immunity of birds, depends on the climatic situation of an area. Immunity can wane. Immunity can wane out of heat stress. We found out that.
Sure.
I am coming, just as you've talked. And then the waning of that immunity brings some slight, not classical signs of Newcastle disease. call it subclinical status of the bed. You don't just allow them to go. If you don't have laboratory, at that stage, when immunity wanes, that is drops because of certain stress the birds has gotten, especially stress. The best thing we advise farmers and advise myself, once we are coming into the heat stress, we look at the back check when we vaccinated, we have to go and vaccinate to avoid waning of the immunity out of heat stress. And then, as at that point, they have started giving you some small signs. You don't allow them to be into a full-blown provoke sign. That is from my own personal experience. But as a vet, you don't have beds to bring you into a. Newcastle disease has come to stay, as far as I'm concerned. But what do we do to avert catastrophe? That's what we're doing. It's a different ballgame that somebody came in from the beds at Newcastle, and you're having 50-60% mortality, morbidity almost 100%. That is where you are talking. Yeah. But when you are talking about when it wants to inch in, this thing will drop. We don't have light, and I'm on 28% of battery. I think at this stage, we thank everybody for being with us. Hayatuddin, I hope you understand what I'm saying. We are in the field, we are in contact with these birds and monitor them per second, not when we are told to come in. No, we are in it already. And we are not there on an academic, practical, clinical. And maybe that's what makes us different. But we should pick in people like us and making us professors. But because we're not in. So that's it. That's a
I'm not looking at it at purely academic aspect. Actually,
no, I'm joking. No, I am joking. I'm just joking. It's a joke. No, for me to say it's a joke, it's not. I'm not serious. We're just joking. And I told you here, we joke a lot and make happy. No, it's not an academic exercise. Professor Lawal is in the field with me. We struggle for clients in the field.
He's my mentor.
Yeah, and when I was starting, I was poor. I was saying, what is this professor doing in the field? It's supposed to be in AB and allow us make the money. Now, maybe, so that's it. That's okay. So you are not academic. Most of you are in the field also. Especially Lawal. I wanted to cut his leg. When he was from Zaria, he started coming into Kaduna. Say, see me, see trouble. I thought the judge should be our limiting line. But it's okay. Hayatuddin, don't take it personal. We are just joking. Oh, I'm joking.
No. It's understood. Yeah, Prof is my mentor, actually.
Every person is mentor. Prof, who is mentoring you? Nobody. You are everybody is. You are mentor to everybody. Nobody has mentored you. Okay. Thank you very much.
You have forgotten Polaudu.
Yeah, okay, Polaudu. No, you know when during my fellowship program, he was the one that supervised my thesis. And it was a war.
You have forgotten Umo,
and then ACU Abdullahi. Don't worry, I know them. Okay, yes. I think we are coming to the end, so I can rush to Kaduna conference. Lawal, are you in Kaduna already? Or you are not coming?
I'm in Zaria because of this. If I can make it, I will come.
Okay, I will rush there. It's here with me. So take care. Bye.